Welcome to the So That's Why podcast, where we unpack the science behind everyday questions. I'm Jen.
I'm Chris.
And I'm Matt.
Right, so today's question, why do we need to manage our cholesterol levels? You know, you're always seeing messages on, get your cholesterol level checked. But this can be confusing because cholesterol is actually essential for life.
Yeah, it's a bit like being told your car needs oil to run, but that oil that you put in might also destroy your engine. Come on, people, let's make it make sense, right?
Make it make sense.
Make it make sense. That should be the name of the podcast.
Yeah, true that. That contradiction you mentioned is exactly why this matters so much, because cholesterol is in every single cell in our body. It builds cell membranes, it makes your hormones, helps you digest food, even creates vitamin D when sunlight hits our skin.
So why does it have such a terrible reputation?
It's because when you have too much of a specific type of cholesterol floating around in your bloodstream, it starts accumulating inside your artery walls, literally building up layer by layer.
And this build-up then eventually is what leads to heart attacks and strokes, right?
Yeah, and we're talking about roughly 140,000 deaths annually in England alone from heart disease, with high cholesterol contributing to about a quarter of those deaths.
That's insane, isn't it?
Yeah, it is. And what makes it genuinely scary is that you can have dangerously high cholesterol for years without feeling like anything is wrong. You know, it has earned the nickname the silent killer.
So cholesterol's interesting, though, isn't it? Because it's simultaneously keeping us alive and also potentially killing us.
Exactly. So in this episode, we'll explore why your body sometimes struggles with the balancing act and why managing the invisible threat might be one of the most important things that you can do for your health.
Okay, so let's start talking about what's actually at stake when it comes to managing cholesterol.
Yeah, so elevated LDL cholesterol, which is effectively bad cholesterol, as we'll discuss in a bit more detail, is one of the most modifiable risk factors for cardiovascular disease. So, there's been some research analysing data from, I think it's over 1 million individuals, and it found that for each 1 millimole per litre increase in LDL cholesterol, or bad cholesterol, is associated with about a 20% increased risk of coronary heart disease.
That's huge.
Yeah, it is, So this isn't just sort of outline advice for best practice. We're talking about cholesterol management having a measurable and significant effect on heart disease risk.
Absolutely. And when your arteries get narrowed or blocked, the consequences affect everything. So it's your brain function, your energy levels, your ability to exercise, literally everything.
Great. So I need to worry about cholesterol for my brain, my heart, and now my general ability to function. The 2020s are really just one long anxiety spiral, aren't they?
I know. Yeah, we're like the Ministry of Doom, aren't we? It can sound overwhelming, but when it comes to cholesterol, it is something you can manage. So for most people, or many people, lifestyle changes alone can reduce LDL cholesterol by 20 to 30%, and taking statins can reduce it by up to 60%.
So lifestyle helps, but also medical science has some good answers for all of this, doesn't it?
Thankfully, yes. So medical science means we can measure cholesterol accurately, and there are those medical interventions that work. The challenge is most people don't understand why it matters until it's too late. So by the time you experience chest pain associated with cholesterol, that significant arterial damage has probably already occurred, potentially over decades.
So managing cholesterol isn't about how you feel today. It's about preventing something catastrophic years from now.
Yeah, exactly. And that's why screening matters, because even when you feel perfectly healthy, you've got to keep an eye on these things.
Yeah. So let's get into the biology. So we mentioned different types of cholesterol. Let's go through them for those who might not know.
Yeah, so chemically speaking, cholesterol is cholesterol. It's one single molecule, but because it's fat soluble, it can't dissolve in your water-based bloodstream. So what happens is your body packages this cholesterol into what are called lipoproteins, and they're essentially like little transport vehicles.
Yeah, I picture them like little meal delivery boxes, but these lipoproteins are shipping cholesterol parcels throughout our body, right?
Spot on. Probably not very tasty food delivery parcels. But these different lipoproteins have different jobs, and the main ones are LDL and HDL cholesterol. So LDL is low-density lipoprotein, and HDL is high-density lipoprotein. LDL cholesterol carries about 2/3 of all the cholesterol into your blood. delivering from your liver to cells for making hormones and repairing cell membranes.
So LDL doing its job is actually helpful, but this is known as the bad cholesterol, isn't it?
It is, and this is why it's so kind of confusing at times. So when everything's working normally, LDL is doing its job in a normal and healthy way. The problem is when you've got too much LDL cholesterol circulating, and what happens is it starts infiltrating your artery walls, gets trapped and starts to deteriorate.
And so your immune system recognises this as a problem, right?
It does. And what happens is that your body sends in the white blood cells, the cavalry, to clean it up, but they get overwhelmed. So they basically keep eating these damaged LDL cholesterol particles until they're effectively stuffed. And
sorry, I'm just picturing my white blood cells just like, oh, that was a taste. I'm so full right now.
Don't stop eating.
I know. I could say they're frothing at the mouth, because literally what happens is they end up looking like foam. It's foaming. So if you've studied biology or remember from back in the day, you might have come across what's called foam cells. And that's what we're talking about here.
Foam cells, it sounds like something you'd find in a posh latte. It's probably not as pleasant when they're accumulating in your arteries, I imagine.
No, just a bit. So these foam cells trigger inflammation, but they also attract more white blood cells, which creates a vicious cycle. And the ultimate result is what is known as arterial plaque. It's a fatty deposit that builds up inside your artery wall. The body tries to contain it, but as the problem grows, there are risks of blood clot formation.
Okay, so then what happens?
So if a clot blocks an artery, you have a heart attack. If it blocks a brain artery, you have a stroke. But the whole process can take decades, which is why early intervention matters.
Yeah, exactly. So then when we look at HDL cholesterol particles, so these are high density lipoproteins. These are essentially known as good cholesterol.
Yay!
These HDL lipoproteins, they work in the opposite direction. So they collect excess cholesterol from tissues and artery walls, and they transport it back to your liver for excretion. That's why HDL cholesterol is known as good cholesterol and LDL is bad cholesterol.
So I've got a plan. Why don't we just like boost HDL, and just call it a day?
Yeah, I'm with you on that plan.
Yeah, done. End of episode.
End of podcast. If only it was that easy, yeah.
Yeah, unfortunately it's been tried. Raising HDL cholesterol therapeutically, it hasn't been as successful as hoped, because what matters is the level of the LDL. We've got to lower that rather than just increasing the other.
So you can't have an LDL cholesterol level that's too low?
Not really, because your liver still produces enough for all the essential functions. Because you might not know this, but 80% of our cholesterol is made by our livers, with only 20% coming from our diet.
No, I did not know that. And it's an interesting one, isn't it, in the face of current messages, that 80% of it is controlled by my liver. That's how it sort of functions. So let's talk about this then. How does this play out, say, with someone like me who used to be in their 40s, has recently entered their 50s, with sort of cholesterol levels slowly... Why are you laughing? Like cholesterol levels slowly climbing.
Yeah, and they do. So LDL cholesterol levels naturally increase with age as the liver becomes a little bit less efficient, even in us, natural athletes, despite age.
Yeah. That's what we are, natural athletes.
And this rising, it's a combination. It's age-related changes, it's maybe a little bit of weight gain, a little bit less physical activity, and dietary shifts.
So what is the intervention then?
So often people will try lifestyle changes first, looking at their diet, exercising with the view to, losing a little bit of weight. But there was a study that documented someone reducing LDL by over 50% in 6 weeks through dietary changes alone. But this does vary between individuals. And for someone with moderately elevated LDL plus high blood pressure, diabetes, family history, even moderate cholesterol becomes concerning.
Yeah, and I guess that's because you're stacking all the risk factors, aren't you?
Yeah, precisely. So risk assessment looks at the whole picture. So the same cholesterol number carries very different implications depending on context.
And there's also an inherited genetic disorder called familial hypercholesterolemia, or FH for short.
I bet you can't say that more than once quickly.
No, I'm not going to. But that affects a small number of individuals, like maybe 1 in 200. And they're born with 2 to 3 times the normal level of LDL cholesterol, and their body's ability to remove that isn't that great. It's impaired.
Yeah, I mean, that, as well as being difficult to say, that actually sounds quite serious.
Yeah, it is. Without treatment, about 50% of men with it do go on to develop heart disease before the age of 50. And they've got 20 times the risk compared to the general population. But often they're started with statins when they're in their childhood to deal with it.
Wow, that's pretty intense. Okay, so that aside, let's get practical. If someone's cholesterol is actually elevated, right? I'm not saying mine is, but I'm asking for a friend. What actually works?
So start with diet. If you can reduce saturated fat from your diet, that's a great start. So if you're a meat eater, start by reducing red meat intake, but also reducing things like full fat dairy items such as butter make a big difference. You still need oils, of course, and fats in your diet. So you need to look at healthy oils. We all know about olive oil being healthier, nuts, for instance, omega-3 rich foods or supplements. These actively help to lower LDL while maintaining HDL.
And fibre is important too, isn't it? Don't forget the fibre.
No, it is. Soluble fibre is brilliant. So for many reasons, but it binds cholesterol in your digestive tract, preventing its absorption. And it's things like oats, beans, lentils, apples and pears, such fruits, that they're all great sources. And studies have shown that as low as 10 grams of fibre per day can meaningfully reduce LDL cholesterol.
So hang on a minute. So now I'm going to have to track my fibre grams as well as, my fat percentages. And I hear a lot of these things and I feel like, man, do I need a nutrition degree just to, figure out what I should be having for my breakfast?
It's a fair point, but maybe we could take a simpler approach and, fill half your plate with vegetables, a quarter with whole grains and a quarter with a protein, whatever your choice of protein would be, and use olive oil for cooking. I think that covers most of the recommendations without getting too complex.
That's really handy. Thank you. Because I do not want to get complex. Otherwise, I just won't do it. So as well as nutrition, what about exercise?
Yeah, of course, it's always important. So when it comes to cholesterol, we're looking for at least 150 minutes, that's 2.5 hours, of moderate intensity activity every week. So think of it as 20 to 30 minutes most days. And that could be a brisk walk, it could be cycling, it could be swimming. It's basically anything that elevates your heart rate.
What about if someone is quite active already and they still have high cholesterol?
Which can happen. And genetics really drive that. And that's where medication comes in. So statins remain the first line treatment. And they can reduce cholesterol LDL cholesterol by up to 60%. Most people can tolerate statins, but there are alternatives for those that can't.
So let's say I have to start taking statins or doing all these things. How long before I see changes? How quickly do they work?
So on average, diet and exercise changes show effects within 4 to 8 weeks, thereabouts. But statins work faster. So you get a substantial reduction within about 6 weeks of taking statins. And the key thing with all of these treatments is consistency and thinking long term. Yeah,
so they act quick, but as long as you're consistent, right? And so cholesterol management then seems to sort of connect to basically everything else in my health regime, really.
Yeah, absolutely. And to look at it in the round, managing cholesterol is essentially about vascular health, so the health of our veins and arteries, because your vascular health touches every organ in your body. And we're talking, brain health, energy levels, exercise capacity. They all depend on having healthy blood vessels.
And we're sleep champions. Sleep always comes up in these episodes, doesn't it?
Certainly does. Sleep affects cholesterol metabolism, and it also affects inflammation. But poor sleep affects how we can process those lipids. So as we always say, everything is interconnected here.
Yeah, it is. It is. So, okay, I'm getting the picture. What about how, if we're looking about all of the interconnectedness of all this, what about weight and diabetes?
So there's a huge connection here. Excess weight raises LDL cholesterol, lowers HDL cholesterol. And then if you've got type 2 diabetes as well, that can dramatically alter how your body, metabolizes lipids, and how the and that also accelerates the build-up in our arteries. So managing your cholesterol often means addressing your weight and diabetes simultaneously.
That's it, exactly. And the one bit of good news is that interventions in one area would benefit another. So if we look at it, exercise improves cholesterol, but also improves weight, sleep and mood, of course. If you've got a better diet, that improves cholesterol, but it also improves your energy and reduces inflammation. Your cardiovascular system is literally the infrastructure that delivering nutrients everywhere across your body, and getting that right creates the foundations that allows absolutely everything to function optimally.
So to recap, why do we need to manage our cholesterol levels?
So we need to manage cholesterol because it's essential for life, building cell membranes and making hormones, but LDL cholesterol causes problems that silently build up over decades and can cause heart attacks and strokes.
So the cholesterol building your cells today might be blocking your arteries tomorrow. It's the ultimate frenemy situation. And I'm just really stoked I could bring in that word frenemy.
Frenemy, I know that was quite an achievement. Because the process is completely silent, you can have dangerous levels for years without actually feeling anything.
That's right. But that one bit of good news is cholesterol is one of the most manageable risk factors in medicine. We can measure it accurately, which is really important. We can understand the mechanisms, and we have those medical interventions and lifestyle interventions that work really well. Early detection and management can prevent decades of arterial damage, and that's so important to keep in mind.
So that's why we need to manage cholesterol levels, not because cholesterol itself is always bad, but because our modern lifestyles, extended lifespans, and individual genetics can push it out of balance with huge consequences. So that's it for this week. Make sure you hit that subscribe button. We're going to keep unpacking the science behind everyday questions. Tell us in the comments what you'd like us to explore. Thanks for geeking out with us. But for now, that's it from me.
That's it from me.
And that's it from me.
Bye for now.